My name's Steve Maud. I'm a filmmaker. I've been making films on various NTDs for the last 10 years or so, across all parts of Africa, working for Uniting to Combat, for Sight Savers, for the Mectizan donation program, GSK and various people. And really going out there and trying to tell stories of elimination through the people that I meet. And I've just got back from Nigeria on Saturday morning. I was lucky to get out of the country because there was the norovirus outbreak on Friday morning. I was interviewing the Ministry of Health, and surprisingly, he delayed my interview a bit because he had to give a whole press conference. So, you might have heard that Nigeria's had success in eliminating, well, not eliminating, but at least breaking transmission in one of their core diseases out there, which is onchocerciasis, or river blindness. So I just wanted to use this as a chance to kind of tell you what I got up to on my trip and give you an example of something that really is working. So who knows what onchocerciasis is? Show of hands, right. So I don't need to go into too much detail. It's a disease that's caused by the bites of black flies in fast-flowing water. It leads to leopard skin, which is caused by unbearable itching. It can cause blurriness of vision and ultimately cause blindness. In Nigeria, it's a massive. Oops. Going the wrong way. Yeah, so there's the fast-flowing water. And typically farmers work near there, they get bitten by these little black flies at night, and over many years the effects start to be felt. Onco devastated Nigeria and still remains that. I mean, across the globe there are 25 million people infected, 123 million people live in areas that put them in risk of infection. So if you look at Nigeria, you've got 36 states. It's divided into 774 local government areas with a population of 191 million people. And yet it carries 40% of the world's burden of onchocerciasis and LF. So it's quite a big challenge when you're trying to eliminate a disease, especially in one that big, and with so many different administrative pockets. So how they got to this point? Well, you've got the treatment, which is Mectizan. It's actually a simple deworming drug that was originally used for deworming animals, and they found that it worked in humans as well. And so the plan on elimination when it first happened was to get everyone taking this treatment, because it was only through universal coverage that you can really bring down the parasite load in the population so that the black flies that are the vectors are no longer spreading the disease. And it was launched off with the African Programme for Onchocerciasis Control, so they were at a stage of control, to make sure that everyone got treated. This was made possible by the donors of the drug of ivermectin, which in this case is Mectizan, run by the Mectizan donation program. And they've pledged to give away as many treatments as are needed till they're no longer needed, which is a huge amount. But how do you get the drugs out to these remote communities? You're thinking, especially with onchocerciasis, it's, as with many NTDs, they're at the end of the road. So you've got the challenges of making sure that everyone is taking this treatment in order to wipe it. So one of the key players in that are the non-government organisations. You've got Sight Savers working out there, you've got Carter Centre, Metasath, and many others, and they pick a state each. So Sight Savers are working in Kebbi, in Nasarawa, you've got the Carter Centre, and they're providing training and support to make sure that the drugs are getting out to where they need to go, and that they're also taken. This is a key thing, because you can, get the drugs to community, but actually no one's going to take them, so unless they have a trusted partner. So those people that actually get the drugs out there and convince the people to take them are the much celebrated community-directed distributors, who are locally selected people from the community, and they go out and they convince the people to take the drugs. These together, so I'm just flying through the background of this. I'm sure many of you know the kind of story here, but these are brought together by the state, with people like Jacob here, who are the go-between, really, between the government who provide people, the NGOs who are providing the training, and the donors, the drug donors who are providing the treatments. And they have all worked together. In 2016, I was out in Kaduna and celebrated the 1000th treatment with this young girl, terrified girl there, Dorcas, poor thing. She didn't know what she let herself in for. But, and it's working. So they've been doing impact assessment now. They're at the stage where they're taking samples from the fast-flowing waters there, which are actually just the larvae, so they won't be infective. You've got to wait till the larvae grow into flies, and then they can do their bad work. They're using fly traps to actually get samples from the field, which they're, again, analysing. And they're finding that the actual prevalence is low enough that they can actually stop treating with Mectizan, which is incredible. I mean, this is what any donation program wants to hear, is that only the drugs are being used where they need to be used. If you think that they were giving out all of these blanket coverage of pills, and if people aren't actually requiring it, that's money that could be spent on other health interventions. So this is like a key breakthrough for them. So it's working. They've broken, so they've Kebbi, Zamfara, Kaduna, Nasarawa, and Plateau now have all seen the transmission interrupted. So the CDDs, you might think, great, so they're not having to give out the treatment anymore. In fact, you have to keep on treating until elimination is declared, because people might not have symptoms of the condition. They have to keep taking it so that ultimately the parasite load is brought down low enough. But you might think, well, what are these community drug distributors now doing if they don't need to be distributing drugs anymore? So what they're doing is they're using them to now treat other health interventions. So they're training them in malaria net distribution, they're training them in polio vaccine distribution, they're using them for other common NTDs as well, so soil-transmitted helminths, schistosomiasis, I think that's it. Anything else? a range of things, which is amazing, because you've got this great resource at the heart of the community, who are medicine savvy, they're trusted and respected by the community. So they're kind of repurposing these people for other things. And it's kind of made heroes of the CDDs. So now they're recruiting CDDs who are very young, because everyone kind of wants to do this, and especially in Muslim communities like Nasarawa, where it's hard for a man to go in and talk to a woman. She won't let them in out of sort of cultural sensitivities. So they've got this young generation of CDDs who are literate. They're taking quite a lot of responsibility, filling out quite complicated paperwork. But they feel like the future, and I went to this training session and I just found the room full of hope, which was very exciting. The other nice thing now is that now that everyone's being treated, they can really focus on what the important elements behind NTDs are, which are the people. They've moved into a phase now of morbidity management and disability prevention. So they're helping people with these NTDs who are traditionally just someone that has to take the pill. They're treating them as people. And this young lady here who has lymphatic filariasis, I met as part of a WASH program that the Carter Centre run, teaching them how to, if they clean their legs properly and if they hold them in the right direction and things, the swelling can be reduced and they can have a good quality of life. And she had pride in her eyes. It was just so moving to see, especially with there were new people coming in the group. She had already had training, but you had a new lot who'd suffered all the stigma that these people suffer in their communities. And to see people like them with smiles on their faces was just very, very powerful. So for me, that was a really, really exciting thing that I saw. I also saw that they're joining the dots on all the NTDs. So this was a meeting with Sightsavers where they were putting together new literature. Traditionally, you'd have had Mectizan up here, you'd have albendazole up there, you have all these different things going on, and it's a lot of mixed messaging for the community. So now they're putting them all together. They're doing 5 NTDs as well as some other conditions that CDDs can be looking out for. But it felt like things are coming together. Things are coming together. And for the government, this was brilliant. You can see the joy in the Ministry of Health's face there. To be honest, that was taken at the end of a day when he'd been dealing with coronavirus outbreaks, so I don't blame him for not smiling too much. But you've got Michael, who's an entomologist, he's about to retire, and he says he can leave his job now feeling like his work is done. You've got Dr. Chukwumwa there, who's the head of the NTD department, who has a boxing glove to show that they can beat these NTDs out of the country. But there was generally a real sense of a strengthened, people, they bought into NTDs there. The London Declaration in 2012 obviously helped galvanise it, and it helped ministers realise, hang on a sec, people are taking an interest in us, we better take an interest in this ourselves, which helped lift diseases from being neglected into actually, higher up the agenda. But, they've got stronger resources now. The Minister of Health said that with a coronavirus outbreak, they know that they have a body of educated health workers in the most remote parts of this country, which is incredibly powerful. And Nigeria know how to respond to outbreaks. They have Ebola, they have various things happening. So for them, coronavirus, he was concerned, but you feel like they have the capacity to deal with these kind of things. So the sum of the parts of this trip felt hugely bigger than all these little interventions which I've spent years filming. When they come together, you get this kind of mass surge of positivity, really, about the potential for change. These are diseases that people have lived with and thought they will always live like that, and now they're being eliminated. Sunday Isiaku from Sightsavers has said that the roadmap is to set 2030 for the elimination. He said they're going to do it by 2025. So it was just a very wonderful trip in that sense. It was wonderful for the communities. This was the community called in Nasarawa, and it was called Bayandutsi, which means behind the large rock. And they're no longer treating for onco there anymore, or LF. And they said to me, we want the Mectizan because it helps with bed bugs, it helps with bed lice, it helps with all these other myriad sort of magical solutions that they put to it. But there's a sense that, the distribution of these drugs is part of their lives, it's part of their communities, because it's people coming in, caring about them and making a difference. So it was a very rewarding and inspiring trip for me. And I got made chief of my local village. I was given a bow and arrow, and I'm now chief of Shepherd's Bush. Anyway, so that's my story from Nigeria. I'm Steve Maud, Cloud9 Media. Thank you very much for listening.